April 1, HHS RIFs 10,000 employees effective June 2. Now, by now you've been secretary for 6 weeks, so this was RIFs, not the forks, but you were involved in the decision about these 10,000 RIFs, correct?
Yes.
And in tandem with your leadership team, correct?
Yes. Yes. And as I said before, I pushed back on certain ones and canceled certain ones.
Yeah. You confirmed that 20,000 employees have been let go at HHS, 10,000 RIFed and 10,000 forked. Do you know how many of the 20,000 were veterans?
No, I do not.
Where does the rubber meet the road on 20,000 RIFs and layoffs and forks? In people not getting cancer trials, and I appreciate your willingness to help Senator Murray's constituent, in state grants being canceled, in Virginia losing $425 million in funding to the Virginia Department of Health. But here's a small example. All of our offices do casework. All of them do casework. And we get requests from constituents all the time. CMS is the largest agency in the federal government. Its budget is nearly twice the size of the Pentagon. And people who depend on Medicaid, Medicare, and the S-CHIP program really, really depend on it. And it's the most consistent in the top 3 or 4 in terms of constituent requests to my office. Answer this question about Medicare or Medicaid or the S-CHIP program. In every administration I've served with, Obama, Trump 1, Biden, I get answers to questions on behalf of constituents. I may not get them as fast as I like, and sometimes I like the answer and sometimes I don't. But let me show you what CMS is now doing to answer constituent questions. I've omitted the name of the constituent, and I've omitted the name of my staffer. This was very recent. A hardworking retiree, patriotic taxpaying American who's on Medicare wrote to ask CMS a very simple question about Medicare. Couldn't get an answer. Asked us to reach out. We reached out to the Medicare Part C and D Congressional Liaison Office. And here was their answer to our basic question. Unfortunately, there is not an update to provide. With the recent change of administration, we are unable to provide any information on matters related to Mr. X's request, Congressional Casework Team. I mean, if you're just an everyday, hardworking American retiree on Medicare and you have a basic question about it, you ought to be able to get an answer. And I'm just going to say, I've shared this with my colleagues, and many of us are having the same experience where our constituents can't get a basic question answered. I wonder if 20,000 fewer employees is connected to this. I yield back, Mr. Chair.